Hello, I'm Dr. A.J. Brickler. When I was a little kid, there were 5 things that I wanted to do when I would grow up. Number 1, I wanted to be a great husband and father. So that really is 2. And number 3, I wanted to be a teacher. Number 4, I wanted to be a pilot. And number 5, I wanted to be a doctor. I had seen as a child my father, who was a practicing physician, practiced for a long time, and he got so much enjoyment out of it, so much reward out of it, that it seemed like the ideal thing for me to want to do. Fortunately, through hard work and the grace of God, I got to be able to do all the things that I wanted to do as a child when I grew up. It's important to realize that if you put hard work into anything, that you can accomplish almost anything. And as I rotated through my rotations in medical school, trying to define exactly what type of doctor I'd like to be, I rotated through all the different subspecialties. There was psychiatry, internal medicine, pediatrics, and initially I had thought I might want to be a pediatrician. But general surgery and OB-GYN were the last 2 rotations, and I found that those were the most intriguing to me. OB-GYN gave me the advantage of all the different other parts of medicine that you can find, with the proviso that I'm dealing with only one gender. That was probably even a plus there, because it's the best gender. But I found that OB gave me the opportunity to deal with patients from the time that they first come in to see me until the time that either I'm no longer to practice or they're no longer around. Maybe they moved someplace else or something like that. It also gave me the opportunity to do surgical procedures, which I find fascinating. It gave me the challenges of internal medicine, of trying to figure out a problem while carrying on a conversation. And one of my mentors, Dr. LaSalle Lafall, told me that if you just sit and listen to the patient, they'll tell you what the problem is. And so carrying on a conversation and a dialogue, it became an important part of incorporating that into my practice to understand what's going on. And probably the most fun thing about obstetrics is delivering babies, and trying to do so in as natural and happy way as possible is what I aim for. Being able to deliver a baby and allow the mother to pull it up to her chest and see that first baby take its first breath is always a miracle and always an enjoyment for me. So fundamentally, being able to do all of those things that I wanted to do as a child, I've been very fortunate in life to have a wonderful wife that supports me and 2 sons that are my pride and joy. I've learned to fly airplanes, and I've learned to dive, do scuba diving too, for that matter. And all of the things that I as a child thought might interest me, I've engaged in the challenges and moved along in my life. One other thing that I wanted to point out was that I remember so clearly the day that I got the letter that told me that I was accepted to medical school. I had gone down to pick up the mail because we were always anticipating what might come on any given day, and I got my first acceptance letter. And I remembered the personal statement that I had written that they reviewed to let me get into medical school. You had to write a little thing about your desires and what it is about medicine that attracted you and what made you think that you were a good candidate to fill a slot in a medical school. And every time I get that call in the middle of the night at old dark 30, when it becomes apparent to me that I'm going to have to rise myself out of a decent slumber if I had to get a chance to get any slumber that night. I think back on that personal statement, that little bit of extra motivation to get you out of bed when you would be much more comfortable laying there and take care of someone. And I think everybody who is a practicing physician or caregiver needs to reflect from time to time on all the motivating factors that brought them to this point in the first place. And it makes your life so much easier in terms of doing some of the unpleasant things that we wind up having to do as part of our job. Even the pleasant things, it just adds to it. And I think that that's an important part of being a physician or a caregiver.